All right, we'll go ahead and get started today. My name is Alicia Carwall, and I work for Ask Resource Center. Today we have Katie Peck with Easterseals, Iowa, who is going to be presenting on the HIPP program, or the Health Insurance Premium Payment program. She's going to be providing us an overview. Before we begin, I just have a few housekeeping notes. Today's session is being recorded. It will be available shortly after the recording for your viewing on YouTube and the Ask Resource website. If you do have questions during today's presentation, we ask that you please put them in the chat and access the chat feature. We will be monitoring the chat, and those questions will be addressed at the end of the webinar today. So we won't stop and interrupt her presentation. We'll save those until the end. And then last but not least, a very important note, there will be an email coming to you shortly after the webinar today with a survey in it, and we would greatly appreciate if you take a few moments to fill that survey out. It helps us secure our funding to continue doing the work we do to support families and professionals. So, Katie, thank you so much for being here. We're glad to have you. I'm going to share just a little bit about Katie. Again, she'll be presenting on the HIPP program today. Katie Peck has provided case management for 15 years at Easterseals, Iowa, and currently is the Director of Customer Care and Compliance. And so without further ado, I'm going to turn this over to Katie.
Yeah, thank you so much. I'll go ahead and share my screen with you, and then hopefully we can answer some questions. So, like she said, we are touching base on HIPP, so health insurance premium payment. And I'll give you a caveat to begin with, is just that the case manager is not the expert on this program, nor the determination maker, but we do help with applying or resources and giving the information through our case management experience. So DHS is the one that maintains that. They do our eligibility for us. So let's see. Okay, so we're going to answer these questions initially, and then if there's other questions at the end, we'll come back. But what is HIPP? So it stands for Health Insurance Premium Payment. It's not super well known now that the managed care organizations are involved. There's just a small number that access the program, but more could be eligible. It is meant to provide a cost savings to the state Medicaid program. So it looks at, they will look at, are you cost effective, which we'll talk about, but it helps pay premiums for your private insurance if someone's on Medicaid and they determine that cost effectiveness. Ultimately, it lessens the burden on state resources that are provided through taxpayer dollars. And then it allows the Medicaid system to dip into what we call different funding buckets, I guess, if you want to look at it that way. So cost effectiveness, it is a formula that is ran by the HIPP program at Medicaid. So they look at your premium cost, deductibles, the average cost of Medicaid that is, being covered under your services, or oh gosh, all your dental things, all your doctor appointments, that kind of stuff. So how much are they paying versus how much is your insurance costing? What's it covering? If the state saves money, then HIPP could support paying some of your premium. And then they look at it compared to the cost that the managed care companies are paying. So managed care companies get what we call per member per month rate. So regardless of how much they support someone or what services they're providing, each member gets a bucket of money sent to the MCO for them to provide services. Whereas the traditional model, we look at more utilization. So what's being used versus the per member per month rate. So they're comparing it there and just trying to see where do they save money, which way is best. So qualifications. So there's quite a bit of breakdown on who qualifies, who doesn't. But ultimately, if someone's accessing Medicaid and has a private insurance, and they deem that it's cost effective, then that would be somebody who could potentially qualify for HIPP, where they're going to reimburse you for part of your monthly premium. Common reasons that someone might not be eligible would be things like you're Medicare eligible as well. So you already have increased access to insurance coverage. So they're not going to pay for Medicaid to be covered since you're already accessing lots of insurance lines. There's Medicaid for kids with special needs. I think it's MKSN. And that allows for different guidelines to be covered under Medicaid that traditionally wouldn't be qualified. And so that's already covered. If there was a temporary plan, so you have temporary coverage of insurance, then they're not going to cover you. Or if you have subsidized insurance, then there are no premiums to be paid. And so there's no incentive for them to pay any of your premium back. Or high deductible plans, and that's just because the coverage cost is so much higher for them to even kick in that they're not going to pay for that. So those are basic things. And then benefits of HIPP would be, there's pros and cons to any system, but you do potentially have the option of providers being reimbursed at a commercial insurance rate rather than just a Medicaid coverage rate through your private insurance. So that might open up different provider types, different specialists. It will bill private insurance first and Medicaid second. So that may allow for some different provider options. The Medicaid program will save some money, which stretches dollars for others' needs or other people that maybe have a need. And then you yourself are reimbursed the cost of commercial insurance premiums to help cover your Medicaid member. That savings then is transmitted to all taxpayers because there's additional money available. They don't have to recoup in other ways. And then you also do get a non-MCO or non-managed care traditional case management model. So you're going to get at Easterseals, you would get myself, and then hopefully you're finding that our communication is collaborative and responsive, and some of that can be a little bit more challenging at the MCOs with a higher caseload and higher member numbers to serve. We definitely have a smaller caseload on a traditional side. And then it would not change any service options that are available. So, waiver access is waiver access regardless of who is funding you. But the managed care companies may have some extra benefits that the fee for service or HIPP side doesn't, like, maybe you're eligible for a free cell phone or incentive dollars to go to your annual medical appointments, things like that. Whereas traditional case management or the side that I provide, we don't have that available to us. And then options for case management do change. So if you are HIPP eligible, you would not have a managed care company for your case management. But in Polk County and surrounding areas, then you would have access to other agencies outside of DHS, which you do have them as an option. But you would have Easterseals as an option, Link Associates, ChildServe up to 26, or community support advocates as well here in the Polk and surrounding areas. And then, like I said, hopefully you would find that, those service lines are a little more collaborative. The compassion is still there. We're resourceful, relational, those kind of things. So not that the MCOs aren't, just that's something that hopefully you would see. Okay, so I stuck this on there for just additional information. If you have questions on it, there's a super simple application to start the process. The picture here is that application. So that gets sent in over to the team at DHS. Then they would review that information, and then they would request additional documents such as, plan coverage information, the cost of what's being requested, pay stubs showing the deduction, insurance cards, different claims that have been paid. They would request all of that to be able to run their formula. Typically, they're going to look back at about 12 months of claims for your medical records. But if you're someone new, to it or to the insurance or to Iowa, whatever, you can also look back at your pharmacy side too. They don't typically pull that, but there may be some coverage there that would help to show cost effectiveness. And then you also may have things coming up that weren't in the 12 months prior, but maybe are on the horizon or are still in need. Like maybe you had a surgery that is coming up, so it's not reflected in old statements, but it will be something on the horizon. Or maybe you're on a wait list for a specialist or therapy services. With COVID, I know a lot of people had postponed some things that were just kind of routine maintenance, but still not identified as essential medical needs during that time, and that stuff all came back up. So we've had some submissions to show those dollars are pending, but still a need, which has kept HIPP in place. And then I would suggest keep copies of anything that you submit. So if you're sending in, any plan coverage, you're faxing it, you're dropping it off, whatever, just keep copies of those things, because then if they have questions or, paper gets lost, you have those documents readily available and you don't have to re-hunt them down. So, and then those that like Iowa code, I included that link as well. So you can dig through there to see all of the, breakdown of who qualifies, how do they run their formulas, any of that information. Let's see. And then questions would be, so this is your HIPP program contact. If you have any questions, I know they're super helpful. They will answer questions on, will this kind of thing cover? Is this something we need to submit? How do we apply? All of that. So that information's there. And then my information is here too. So if there's a one-off or, you have a specific question, I can help try to answer that or point you in the right direction. And then I included Renee Bell, who's our intake coordinator for all Easterseals services as well. Should you have additional questions or service needs on our end. So, and that really is the brunt of HIPP. So I'm going to leave it open, and then any questions that you have.
All right, thank you, Katie, so much for all of that information. I do believe we have a few questions that came through the chat. I'm gonna have Sarah, my colleague, ask those different questions.
Hi, so the first question is, how do I get a case manager assigned? This person was recently approved for HIPP, but they were not able to figure out who is their case manager or if they have a choice.
Wait. So I'm assuming you were under managed care previously.
Yes, correct. They were under an MCO and now they're fee for service on the ID waiver.
Yeah, so I mean, prior case managers should be able to help figure that out. Otherwise, you can give me a call. I'm happy to help figure out where you're at or who's with you. Sometimes historically, it seems like when HIPP kicks in, it is retroactive to when you applied. So if you applied early January, they'll kick you back to, January 1st. So then here we are on the 30th and you don't know who your case manager is. So that will mean that anything that was funded for this month is no longer funded. So you do need to get in touch with the case manager soon to get that in place. Also making sure that your doctors or anybody that you visited in January are aware of the insurance change as well. But in the meantime, yes, I would say, your case manager that was working with them should be able to guide you in the right spot. Otherwise, I'm happy to help how I can to figure that out. And then for choices in case management, I'm not sure where you're at. So that could be a question there. But if you're here in the Polk and surrounding, then that would be those options for the agencies here outside of DHS.
Okay, the next question is, how would families typically hear about the HIPP program?
Boy, gosh, I don't think they hear about it near as often as they probably should. Honestly, I'm not sure how they always hear about it. I think a lot of times it's probably parent to parent, right? Like you guys talk, and so then, oh, I have this, and we can, maybe we apply. Otherwise, if you have private insurance, case managers can say, hey, are you on HIPP or have you applied for HIPP? Sometimes you lose eligibility and you get it back, and you just kind of forget that it's an option. So that's, again, thank you for letting us share this information, because I think it is a underutilized resource, but it is available. So yeah.
Okay. How would you work on transitioning to HIP if you are currently working with an MCO? So what would that
Yeah,
transition look like?
sure. You apply, and that can be done with or without case management knowledge. They don't have to be part of that process. But yeah, you would apply using that form, follow through the timelines and the documentation needs there, and then you will be notified that says, hey, you're HIP eligible as of this date, and it is retroactive to the first of the month when you applied. So then you would want to work with your case manager to say, hey, I got this letter, we're HIP eligible. If you wanted to let them know ahead of time that we've applied, we're waiting to hear back, then hopefully they'll talk with you about some of the options for transition and, starting that process proactively. And then, lots of times I'll get calls from people that say, hey, I'm on HIP now and I'm not sure who my options are. And so then we just talk through that and figure out, are they wanting our agency? Are they wanting a different agency? Where are they at? To see what options they have. So like I said before, I have seen that HIP eligibility will, in the MCO system, they just get a notification that someone is no longer on their assignment. And so I feel like transition could occur smoother, but I don't know, we're this far in and it hasn't yet. So I'm not sure what that looks like long-term, but if you've gotten the letter, you're HIP eligible, then you can reach out.
Okay, this next question is, after you've provided additional information following the initial application, so I'm assuming this is kind of like they've done the follow-up, how long does it typically take to hear back?
Typically, so I would say probably within 30 to 60 days. Most people that I've had transition on have heard back. I would say that time frame is typically what you're going to see.
Okay, then the last statement is a question saying, my granddaughter is on Medicaid only, should I apply? And so I don't know if that is a case of going back to, you need to have both components, right? Just being on straight Medicaid would not qualify you for HIP. It would have to be having that other piece.
Yes. Yeah. So the person would have to have Medicaid and private insurance. So if both were in place, yes, you could apply for HIP. But if there's no private insurance in place, then there's no premium to help pay.
Yes. And the next, I guess it's not really a question, it's just a statement, just saying that there isn't really necessarily a really great way for HIP to be shared out. So maybe that's a conversation that we need to be having about how we can help with that.
Yeah. Yeah. No, I hear you. I don't think there's a great avenue for it. I know I've been trying to get the word out just a little bit more frequently in different avenues, just because there is some benefit to it, and obviously it helps pay some of those insurance premiums for family side.
All right. Well, thank you again, Katie, for joining us today and presenting on the HIP program. I do think one way, and I agree with you, Katie, I think it's often word of mouth, parent to parent, different groups that you might be in. So feel free. This again is being recorded and will be shared out on our website. If you know other families that might be interested in learning more about this, if you're in any Facebook groups or anything like that, feel free to share out in those places. We will obviously share out with our groups as well. But just again, there is no good system, I don't think, for letting people know about HIP. And so the more we can each do, the more options for families out there. Also, with that note, don't forget to like and subscribe to our YouTube channel and find us on Facebook for daily tips and information that are out there. We also have a online support group that's offered the first Monday of every month. And so that will be next Monday. It's called Ask Each Other, and we hope you will join us for that. You would want to sign up just like you did for this webinar. And again, that's the first Monday of every month. Katie, we really appreciate again having you on here, and we are super grateful for you to have the opportunity and agree to the opportunity to share out about the HIPP program with the people on here today.
Thank you so much for the opportunity as well and the space to do so. And yep.
All right. Thank you all for joining us today too, and we look forward to seeing you again in future webinars. And also, just a plug, we do have our Together We Can conference coming up. It's always the first Saturday in May, so I believe that lands on May 6th this year. So look to our website for more information on that opportunity as well. All right, thank you and have a great day, everyone.